Kelsey Kuehn is with us from McKenzie County Health. She is a speech-language pathologist there. They have a new facility we're going to talk about. We're going to talk about Kelsey herself a little bit and about how she likes being part of the team at McKenzie Health. Nice to have you with us today, Kelsey. How are you?
Good. Thanks for having me.
I had a chance recently to tour your facilities for a little open house, and I could see the smile on the faces of so many. Talk about first this new facility and what it provides for your patients.
Yeah, so it's a incredible facility. We're really lucky to have it. It has 4 treatment rooms and then a fun factory sensory gym that allows just lots of movement and opportunities for kids to meet those developmental milestones.
And, I know that obviously there's many places for people to get therapy like that, specific to speech therapy. Tell me a little bit about just working in a facility like that, having patients in and out of there, how it makes a difference.
Yeah, absolutely. So this facility allows for just a lot of like gross motor movements, which gives kids a chance to not really think about what they're doing as far as speech, but more so like incorporate movement into the therapy we do. So whether it's, playing with animals and they're going down a slide and then you practice words like go, go, go or slide. It just gives a lot of opportunities to incorporate other ways for speech therapy to happen.
Tell us a little bit about what is most fulfilling about what you do and how you see the transformation of your patients with the therapy. What floats your boat, so to speak, most about the good work you get to do helping these folks?
Yeah, I would say, my pride and joy is kind of the littles and especially the autistic population. It's really, really fulfilling for my heart to see kids go from being nonverbal to giving them a voice, whether it's verbal communication or giving them or getting them access to a speech generating device or AAC device, getting them, their eyes light up when you get them to be able to communicate like they want to.
It's pretty special. I mentioned in your title that you're a speech therapy pathologist. Talk a little bit about your training, kind of your focus and specialty in doing what you're doing with those kids you're talking about.
Yeah, so I guess, I went to grad school and then I started working in a private practice and I kind of found my niche in this like the autistic population. And so I've done further education in something called Gestalt language processing, which is most common in the autistic population. So when you hear kids like scripting from movies or saying things they've heard from other areas, whether it's like things their parents have said, they usually say it in long fragments, and then we break it down to single words to talk like you and I do. And then I've also done further education in sensory processing training for speech therapy. And so that's kind of where I get to use the swing and the slide and the crash pad and incorporate language into that. So it's more so building that connection before expecting communication.
What kind of feedback do you get from family members about that journey and how they help? What do they say to you most? What do you hear a lot?
I guess like the most I hear is like finally someone gets that my kid is communicating in a way that's not just something they heard, like it has meaning behind it. So they kind of feel a lot of families feel reassured that their kid's not just talking gibberish and they're not talking out of context, but they have purpose behind what they're saying.
Tell us a little bit about yourself, where you went to school, where you grew up, how you got to Watford City.
Yeah, I'm originally from Malta, Montana, which is a small town on the High Line on Highway 2. I went to undergrad at Rocky Mountain College in Billings. I thought I wanted to be a physician's assistant at the time. And then I job shadowed in a private practice with occupational and speech and physical therapy. And I quickly switched my mind. And then I did a little bit of a career change because I graduated a little bit early. So I went and taught science for a little bit in a small town in Westby, Montana. And then I got accepted into grad school at Minot State and finished there. And then I ended up in Williston for a couple years at a private, and now I'm in Watford.
That's great. How do you like Watford?
It's a great place to be. I really enjoy it. I enjoy the community aspect of it. It's a small town, but still a little bit bigger. It gives, there's just lots of opportunities for different things.
And talk a little bit about McKenzie Health. You've obviously worked other places, been to school, interacted with other healthcare providers. What do you like most about McKenzie Health?
McKenzie Health is a very supportive organization to work for. They have exceeded my expectations in helping us get what we need to provide the best services. I can't thank, the board and the CEO and everybody enough, because they've helped us make these milestones happen to provide good services for this area.
And what you're explaining there isn't something that happens in every healthcare organization, right? I mean, yeah. That seems to me to when you contrast it with other things you hear about healthcare, that's pretty extraordinary, isn't it?
Oh, extremely. To have the support that we've had, and I mean, we just kind of threw this idea out there, and they took it with full stride and made it happen, which doesn't happen everywhere you're at. So the support is incredible.
And when you say they took this idea, your vision, again, this is a good example of, the staff saying, hey, if we did this or we did that, here's what we could do. And somebody in management isn't saying, no, you will, you shall, you must, but saying, interesting idea. What was the idea? What was different? What did you bring to them?
Yeah, so their pediatric therapy wasn't really, they had some outpatient pediatrics, but not a ton. And they allowed us to kind of throw our ideas that we needed a bigger facility to provide more quality care for the kids in this area. And they just let it, gave us the tools we needed to create it. And yeah, it just wasn't, the first facility we were at just didn't have the tools we needed to help kids succeed. Yeah,
it's great. And hopefully open some eyes today about that kind of specialty being available right in Watford City. And that's what it really has transformed the availability of healthcare and keeping people right at home to get that kind of great care. So great job by all of you and suggesting that, and certainly to Pete Edis and his team as well, McKenzie Health, for making it happen. Thanks for sharing the story with us today, Kelsey. Yes. We appreciate it.
Yes, thank you so much.